Hey, everybody. Today, our podcast is going to be talking about iron deficiency and ferritin. And I'm really excited about this topic. We've started to run ferritin levels in our kind of, I guess you could say, routine blood more often. And we are finding this to be very, very common.
It's one of those things that it's iron deficiency and iron deficiency anemia are common, and they're underdiagnosed, and they have significant consequences despite widespread availability of an effective treatment.
Yeah. And I'd say what I want everybody to understand too is that iron deficiency does not necessarily mean anemia, and anemia does not necessarily mean iron deficiency.
Most patients, when they see their doctors, their only assessment of iron status is through a CBC, which is only measuring their blood count. And if they're not anemic, they could still be iron deficient. So it is the most common nutritional deficiency in the world. And you think about it, there's a lot of nutritional deficiencies that we talk about. In fact, on this podcast, we've talked about several, but iron is number one.
And a lot of times this has to be in the back of your mind when somebody just does not feel great. And we're going to dive into like all the symptoms and everything. But I mean, this is the leading cause of fatigue in menstruating women. And also there's some out there that believe this could actually be a causal effect of fibromyalgia. So what is iron, and what is the role that iron plays in the body?
So iron is a mineral. It's used in over 100 biochemical processes in the body. And because of that reason, anything could possibly be a symptom of low iron. All right. And we're going to go through the list of possible symptoms, and it's quite long, so you might want to replay that a few times. But it's essential for red blood cell development. And red blood cells are produced in the bone marrow, and iron is required for the red blood cell to bind to the oxygen that we breathe in.
And so I think of, the people who are affected by this. The first one that comes to my mind is like a pregnant female, right? And now we always say, shortness of breath, right? When they're walking. It's not always just due to the body habitus. They could be iron deficient.
Absolutely. So who is affected? Let's talk about the people that are affected by low iron levels.
Typically, like we said, pregnant females, but we also see vegetarians are classic, and I call this nutritional deficiency, right? Because we know iron, we think of blood. I mean, we know that. So if you are not eating meat or red meat, then you typically are not getting enough iron source. And we're going to talk about the, two different types is there's heme iron and there's non-heme iron. So the heme iron is associated with red blood cells, and the non-heme is the vegetarian source. And they're just absorbed differently. The heme iron is better absorbed in the body. And so when vegetarians are eating, or pescatarians, you're eating all of the vegetables that might be giving you the iron. We're going to kind of go into how there is a contradicting situation with that.
And so testosterone therapy, there's plenty of people now who are on testosterone, but that can eventually lead to lower iron levels. And that's through a couple of different mechanisms, right? So one mechanism is that testosterone therapy can cause your body to make more blood. So you get something called a secondary erythrocytosis. So when you have a secondary erythrocytosis, a lot of times you're going to need to have phlebotomy to take some of that blood off. And when you take phlebotomy and when you take blood out, you're taking iron out with it. But also just the fact that your body is making more blood, it requires more iron to do that. And you can deplete yourself of iron even if you're not getting therapeutic phlebotomy.
Right. So then that goes hand in hand with the young kids, like infants and adolescents. They can be iron deficient due to the rapid expansion of blood volume needed to grow with their body. So we know when you need more red blood cells, you have to, as you already mentioned, iron is critical for the making of red blood cells. And if you're, growing at a rapid rate, you might not be able to produce that very quickly.
And you also talked about pregnancy, which is also due to the rapid expansion of blood volume. But the number one cause in young females is menstruation, right? And that's due to blood loss. And women can have heavy menstrual cycles that where they lose quite a bit of blood, and then they rebuild that blood, but they're not repleting their iron stores.
And what a lot of women don't understand is, I think people who have heavy periods, just contributed to say I have heavy periods, and we figure out a way to handle it. Like I heard a story of somebody saying, oh, I just wear an adult diaper to bed because my period is so heavy. That actually is a sign that something isn't right. And so that should be investigated, because there is a vicious cycle that you can be iron deficient from having a lot of loss of blood from your heavy menstrual cycle, but then that could actually be a cause of iron deficiency and so on. So whenever it's not something that I want you to just go ahead and ignore,
Right. The low iron can trigger heavier periods.
Exactly.
And therefore, when you fix that, the iron, then typically their periods get fixed too.
Right. They can become lighter and less days, and it's amazing. Mm-hmm. So gastrointestinal bleeding from ulcers, tumors, or hemorrhoids, people don't realize there's other ways we can lose blood, and you might not even see it. You don't always have to see blood in your stool. You can have what we call occult blood, which is hidden.
Mm-hmm. And elderly patients tend to have low iron levels for a variety of different reasons.
So there's, as we mentioned, there's many foods and supplements that can also block the absorption of non-heme iron absorption. So whether you're getting it through food or supplementation, your multivitamin or whatnot, if you're taking other supplements at the same time, or you're eating this with foods that contain the phytates that we're going to talk about, that can block the absorption of the iron. So here, even though you're eating all these iron-rich foods, you think you're getting it, it's not being absorbed.
Right. And iron absorption occurs primarily in the small intestine. So there are certain conditions that affect the small intestine that can interfere with the body's ability to absorb iron effectively. Some of these conditions are celiac disease. Right. We see a lot of gluten insensitivity, but there's a lot of people with celiac disease too. Crohn's disease is another one. H. pylori infection. That's something that is more common in third world countries, but it's quite prevalent in this country as well. Hypochlorhydria, which is decreased production of stomach acid. Small intestinal bacterial overgrowth, also called SIBO. Gastric bypass surgery is a big one.
Well, because a lot of the iron is absorbed in the stomach. And as you mentioned in here, without stomach acid, you're not absorbing. The stomach acid is what helps break down things and helps us absorb things. And unfortunately, how many people out there are on PPIs, proton pump inhibitors? You've got your Prilosec, or also known omeprazole, Nexium. I mean, the list goes on. And people are on these things for a long time. They don't realize the damage this could be doing to their gut and absorption of their minerals. So the other thing, is the gastric bypass surgeries. They just cut out that layer of the stomach. And so I have a few patients who have had gastric bypass surgeries, and they're on iron supplements for the rest of their life because they'll never get the chance to absorb it naturally. Yep.
So let's talk about the symptoms. And the symptom list is huge. Any number of these things that we talk about could potentially be a cause of or a result of low iron. So fatigue. Fatigue is the most common. And the fatigue can be quite severe. We see people who just say, I just have a hard time staying awake through the day. I sleep plenty at night, and I just don't know why. And everything else has been checked. My thyroid is fine. All my other blood work is fine. But probably nobody has actually checked their ferritin or their iron stores.
Yeah, this is definitely like a remitting fatigue. Like it does not go away regardless of what you do. And brain fog is a big one. You just cannot think clearly. It goes hand in hand with a lot of times with fatigue too.
Yeah, and shortness of breath with exertion. People who say, I used to be able to run 2 or 3 miles, and now I can barely even run a quarter of a mile without getting short of breath.
A rapid heart rate. So we know a normal heart rate is around 60 to 100. And a lot of times people just have that low grade rapid heart rate over 100 and can't figure out why.
And cardiac issues, chest pain can occur, but even heart failure in the later stages. And heart failure, that could be deadly. That's a significant condition that iron deficiency can lead to.
The one complaint I don't like when I see it in the office a lot, because typically I do a workup and it comes back to nothing, but is easy bruising. Just because you have easy bruising does not mean you're iron deficient or anemic, but it can be a sign of that. But it could also be a sign of many other things.
Yeah, in our practice, because we do so much with hormone replacement and with thyroid, we have a lot of people complaining of hair issues, either losing their hair or brittle hair, and both of those could be a consequence of iron deficiency.
I was interested when I found out restless legs is actually a big contributor from iron deficiency. And I know we have heard from several people, like you want your ferritin level, which is your iron storage, to be over a certain number that can significantly improve restless leg syndrome.
Right. And then a couple of weird things that that most people don't know about is cravings. So craving for ice is a big one, and that's called pagophagia. And that is commonly seen in anemia and iron deficiency, but also other forms of pica, which pica is unusual cravings for non-food items. But typically with iron deficiency, you'll see cravings for licorice, chalk, dirt, or even clay.
I'll never forget when I learned this in PA school. There was a girl in my class who she was, I don't know if this is a Southern thing or not, but she grew up and she was snacking on clay. And I was just, that floored me. I was like, I'm sorry, what? So insomnia. So that's another one that we''ve heard, if you have over a certain number on your ferritin level, it can really improve your sleep.
Headaches. When we have people commonly come in complaining of headaches, that's part of the workup of the underlying cause of their headaches.
Cold hands and feet. I'm pretty sure I need to get my iron checked. I am always cold and cold hands and feet. And
nail changes, brittle nails, but also you can get spoon nails. And if you've never seen spoon nails before, you look it up on the internet. It's a pretty interesting phenomenon.
It is. And pale skin is a big one because we get our color from our blood. And so it's very classic. When we do physical examination, we can tell if somebody is anemic or iron deficient by looking at the conjunctiva and the sacs of their eye, their tongue, even the palms of their hand, if their color is not coming back.
And we talked earlier about iron deficiency being a possible underlying cause of fibromyalgia, but along with that is other forms of joint pain and muscle aches. When we have patients with chronic pain, it's another thing that we look at, and we've seen in our practice several times where you correct someone's underlying iron deficiency and their joint pains and muscle aches get better, dramatically better.
Right. Burning tongue.
Yep, that can happen, and dizziness. So, these are just some of the more common ones, but there are others.
The list goes on. As you said, the iron affects over 100 different processes throughout the body, and it can be linked with many, many things.
Yeah, so if you have an unexplained problem or condition that you're worried about, just have your doctor check for iron deficiency. So
speaking of checking, how many people out there do you really think get their iron checked in routine labs? Is that something?
Not adequately. So let's talk about the lab tests that should be ordered and what doctors commonly order and what they probably should order.
I know the most common is a CBC, and I see this all the time when, people transfer their care and we look through the labs and they still have all these symptoms and they're like, well, I'm not anemic. And I'm like, that doesn't mean you're not iron deficient though. Right. So a CBC is just looking at your hemoglobin and hematocrit levels. The hemoglobin is the protein contained in the red blood cells that is responsible for the delivery of oxygen to the tissues. And as we've already mentioned, we've got red blood cells and ferritin and oxygen, and those are very critical. And so the hematocrit is the percentage by volume of the red cells in the blood.
And those are two tests that are pretty much as far as doctors go. And I've seen in the past, even when those are abnormal, even when they're low, the patient still won't get a ferritin or anemia workup. So the next test that really should be done is the ferritin level. And the ferritin is an iron storage protein. Ideally, you want to see that level above 100, and we get so many people who are way below that. It indirectly measures the amount of iron in your blood. Since it's a storage protein, if that number is too low, there is not enough iron in storage. And if it's too high, then there's too much, and that can cause problems too. So first we'll talk about causes of high ferritin. If the ferritin level is too high, it could become inflammatory. There's a disorder called hemochromatosis, which is genetic, in which the body can build up too much iron in the skin, heart, liver, pancreas, pituitary glands, and joints. And that needs to be worked up. And typically we refer them to a specialist for that. But liver disease can cause high levels of ferritin because most of the ferritin in your body is stored in your liver. And there's something called adult Still's disease, which is a rare form of arthritis that can lead to extremely high ferritin levels.
And then tell us about the transferrin saturation percent.
So that's the next test that we would check after ferritin. And that checks how many places on your transferrin that can hold iron are actually doing that and holding the iron where they should be. And we know that transferrin saturations of less than 20% indicate iron deficiency, while transferrin saturations over 50% suggest iron overload. Normal values are between 15 and 50%. So in severe cases of iron deficiency and anemia, that number may fall below 10%. And so we know that if that number is low like that, that patient needs iron.
So in a CBC, there is a differential, and in that, it typically shows us the mean corpuscular volume, which is also seen as MCV. What a lot of people don't realize is that can actually be one of the first signs we see. And so this MCV measures the average size of the red blood cells. So if the number is high, it's consistent with something called macrocytosis. And if the number is low, it shows that your red blood cells are smaller than average, and that could be indicative of microcytic or microcytosis. And these are what kind of guide us, to what type of anemia this would be associated with.
Right. So typically the microcytosis, the lower MCV number, would indicate iron deficiency, whereas the higher number, the macrocytosis, would indicate things like maybe B12 deficiency or folic acid deficiency. There's a lot you can tell from a CBC if you use it correctly, but I don't think that's enough in most cases. So another test that can be done is the serum iron. We don't do that much. That's the amount of circulating iron bound to transferrin, because the reason we don't do it is because I think the ferritin is a significantly better test to check for iron deficiency.
A lot of times I don't really see a low total iron at all, but I can see the other levels are off as well. Mm-hmm. And then transferrin. So transferrin is a blood plasma glycoprotein that plays a central role in the iron's metabolism. And this is what's responsible for the ferric ion delivery.
Right. And then there's total iron binding capacity, which is also called transferrin iron binding capacity. And that measures the blood's ability to attach itself to iron and transport it around the body.
So there's a lot more to this than just a CBC, as you can see. Yeah. But what we didn't touch on yet is, well, we kind of did earlier, is all the other GI issues that are associated with iron deficiency. It all comes back to the gut, as we have repeated with every podcast, but it's about absorption, and people don't realize that. So there's some other testings that you can do to check to see about your gut. And that would be something just as a celiac disease panel. Now, granted, the true way to check for celiac disease is through an endoscopy and getting a biopsy of the duodenum, tomato. And that is the true way to see if the villi are blunted or not. But the blood test could be a generic marker that you can always have checked.
Right, and we can always do a stool analysis. Check the stool for occult blood, like you said earlier, to make sure that there's not some bleeding in the GI tract. Colonoscopy is always helpful. We recommend colonoscopy in everyone who's anemic. And there's the Cologuard test now, which looks for colon cancer primarily, but it will detect blood in the stool as well. And then there's a test called a fecal calprotectin, which is used to detect inflammation in the intestines. And that helps distinguish between irritable bowel disease, inflammatory bowel disease, including ulcerative colitis, Crohn's disease, and IBS.
Which is irritable bowel syndrome, right? Which causes a lot of discomfort, cramping, and diarrhea, constipation. So, that can lead to hemorrhoids. Once again, all of this can lead to bleeding that you may or may not realize you could be losing blood. And then there's SIBO breath test, which SIBO is small intestinal bacterial overgrowth, how to think about that. And this test is important because this is going to see if you have that bacterial overgrowth. All of this is about the bacteria in your gut microbiome. And if that is not working, you're not going to be absorbing anything. So even if you are treating iron deficiency anemia with pills or supplementation, it's not going to work.
Exactly. And another test that we check quite commonly is hormone testing. We pretty much check hormone testing for everything, but it has some uses in iron deficiency as well.
So tell us, there's actually different stages of iron deficiency. I believe there's 3. Why don't you go ahead and tell our audience about those? So
the first stage is iron depletion. And iron depletion is where we catch a lot of our patients. because in this initial stage, the body's circulating iron levels are low, but the hemoglobin levels in the blood remain normal. And laboratory testing would be mostly normal and maybe shows slightly lower level of ferritin, but nothing crazy. Second stage is iron deficient erythropoiesis, which in this stage, the body's iron stores continue declining and red blood cell production becomes impaired. The bone marrow, which is what makes the red blood cells, does not have enough iron to help synthesize the hemoglobin effectively. And the third phase is when you reach full-blown iron deficiency anemia. And in that stage, the iron deficiency becomes so severe that you develop anemia. And then that reduces the ability for the blood to carry oxygen around. Now, if you notice that there's two stages that are widely missed if you're just doing basic blood tests, you only really catch people when they hit that third stage.
Exactly. Now, something I've learned recently was about the hepcidin.
Yeah, so hepcidin is interesting. It's something that binds to ferroprotein and therefore inhibits iron absorption and the ability to utilize iron properly. Hepcidin actually goes up when you use oral iron, which in turn blocks the absorption of iron, and then it blocks the release of iron from the macrophages. So it's one of those things that that when you're taking iron, especially over-the-counter oral iron, it's probably not a good idea to be taking it every day because you're inhibiting because you're affecting the hepcidin, and therefore you're inhibiting the ability to absorb the iron in the body. Hepcidin.
So is this what protects then against the overload? So when people take iron, it's kind of like your body's check system?
Exactly. That's what it's used for. It's a response to protect you from iron overload. Another hormone that's involved in blood production is erythropoietin, which is also called EPO. And that's a glycoprotein hormone that's produced in the kidneys that stimulates red blood cell production. And in patients with kidney disease, we give them erythropoietin to help stimulate their kidneys or their body to make more blood because they become anemic because of the kidney issue.
So we kind of talked about, that's important in the treatment, but if you have proper kidneys and everything and you have great gut absorption, then, the food is the first place we want to start with, right? So we want to start, if you can get this naturally through food and supplementation, that'd be fabulous. So, like we talked about,
if you're not significantly deficient, if you're deficient, you are not going to get enough through food. It's just no way.
I agree with that.
No matter what you eat. So a lot of people say, well, I'll just eat more foods with iron, and it's probably not going to work.
Well, one of the things we actually didn't talk about too much was actually the reference range for ferritin is huge. People don't realize. I think it was like 20 to 350 or something like that. So I'm sorry, and I hate when offices or providers do this where they say your level's normal. Okay, well, I'm sorry. If my ferritin level is 20, 22 even, and is quote unquote normal, but I feel like crap, I'm a patient and I'm not a self-advocate. I don't know anything about this. I'm going to take your word for it. And I'm going to say, well, I guess I'm just tired. No, do not accept that. So just because it's quote unquote normal doesn't mean that you are not symptomatic. It doesn't mean that you're not on the way to crashing, and you can treat this. So what you're saying is, if you're on the suboptimal range, maybe oral will help at that time, or increase your iron intake in your food naturally. That would help. But if we're below that range, how many we see women coming in, like I see levels of like 5 or 6, maybe 3.
Yeah, very low.
That's when you need a stronger treatment that we're going to get to. But for now, what you have to realize is that we talked about the heme foods, and which is blood, and basically coming from animals. And it doesn't have to be beef. It doesn't have to be red meat. Oysters are high in iron, believe it or not. And then there's non-heme foods, and why don't you go ahead and tell us about the limiting the iron inhibitors through the consumption that we learned about with the phytates.
So phytates are things that inhibit the absorption of iron. And phytates come from things like seeds, nuts, legumes, unprocessed grains, and that's usually like the husk of the grain that contains the phytates. And so when you're iron deficient, you want to limit these foods because you want to limit the further inhibition of iron absorption.
And then I learned also taking, it's funny, people might take their vitamins or medications with teas or coffee, but there's tannins in tea that can also be inhibiting as well. And coffee can be inhibiting as well as calcium-rich foods. People don't realize that. So drinking it with a glass of milk, you're supposed to separate your iron from your calcium supplementation. So that's part of where we can say you can eat all the foods you want, but if you're not doing it in the right order, and how many people think about that while they're eating? I don't. And the other thing is I learned that apparently cooking spinach can also get rid of the phytates.
Right. And everybody thinks of spinach as high in iron. But again, it's non-heme iron, so it's not the most effective form of iron you can get. Actually, the most effective form of heme iron is probably going to be from organ meats, things like liver and things that people just don't eat much anymore. But once upon a time, we did consume a lot more of that. Other iron-rich foods are cooked tomatoes, sardines, hard-boiled eggs, like you said, oysters, cashews, raisins, tofu. So you can get some iron in your diet, but I wouldn't expect it to replace what you're deficient on. So let's talk about oral iron supplements. Oral iron, in our opinion, it's really not super effective, and bigger problem is that it's not well tolerated for most people. There's a lot of side effects from oral iron, and there's some caveats that you need when you're taking oral iron, right?
So I know the side effects that people experience is the constipation, nausea, abdominal pain. And one of the things I wanted to just touch on is black stool. So don't be alarmed. If you take an iron supplement and you see that, then that does not necessarily mean you are having a GI bleed, but it's something that you should discuss with your provider anyway. But some of the caveats you were talking about, I think, are enhancements. Is that what you're... So, one thing I always want people to realize is if you're doing oral iron, vitamin C can help that get absorbed. And that's very important, especially for the non-heme forms. So I always say maybe take it with a glass of orange juice. Or a lot of oral irons also nowadays have vitamin C incorporated in that supplement. But you do need about 100 to 1,000 milligrams every other day when taken with an oral iron.
Yeah, and there's something called lactoferrin, which is found in breast milk, which is absorbed in the small intestine. And that binds excess iron and keeps a good balance. And it helps prevent bacteria and parasites during illnesses to keep from gobbling up that iron and hanging on to it. For the most part, though, when you're taking oral iron, take it with food. It works a little bit better when you're taking in food. And there's different forms of iron, oral iron, right? So what's the most common?
The most common one that people get over the counter is this ferrous sulfate. It tends to be the more inexpensive form, but it's unfortunately the most constipating form. And so what people don't realize is the dosing of iron over the counter supplementation. So ferrous sulfate, typically the most common dose I see is 325 milligrams. And that means you're getting only about 60 milligrams of elemental iron or the absorbed iron. And then by the time you actually absorb that in your gut, you're getting very small percent. I'd say around 6 milligrams ish. So it's not very much at all. And then there's also chelated form of iron, that's more tolerated, I would say. But I mean, I've had patients who have tried the chelated form as well, and they can't tolerate that either. And then there's a liquid form that I've heard of other people taking it's called Floridex. This one actually has a little bit of vitamin C in it, and I heard it tastes good. So, because I thought, first thing I heard liquid iron, I was like, oh, no, thank you. But this one apparently isn't that bad.
And then there's ferrous bisglycinate, which is a non-heme iron, which is fine for vegetarians. And it's readily bioavailable. We have quite a few patients who use that. Typically, you're going to need 120 milligrams of elemental iron daily for adults. And that does not mean that if your iron says it's 120 milligrams, it's 120 milligrams of elemental iron. You have to figure that out to find out if the one that you're taking is effective. And we tell patients who are anemic that they need to continue the oral therapy for 3 months after the anemia is corrected to allow the iron stores to replenish. So our preferred route of iron, we already said that the food doesn't work great, oral doesn't work great, but what does work great?
is IV iron. And we do offer this in our office as well because people just feel better much quicker. I mean, like you said, it takes months, but with IV, you usually feel a peak improvement within about 7 to 9 days. And
it's so easy. I mean, it's you're taking one dose of IV iron. You may need to repeat it again in 6 months, and some people do it once a year. But it is the simplest and most effective way of getting iron into your system.
And it only lasts about 20 minutes, I'd say.
It's a 20-minute infusion. Now, once upon a time, IV iron got a bad name. There were different forms of it that caused a lot of side effects and even anaphylaxis, and they were dangerous and had to be done under strict supervision. We don't use those anymore. The ones we have now are very safe, very effective, and very well tolerated, much better tolerated than oral iron.
So I wanted to kind of touch on, thyroid as well, and how a lot of times people, when we already did our thyroid podcast, if you haven't heard it, you should go back and listen. But there's a lot of symptoms that overlap with thyroid conditions. And when people say, oh, I have a normal thyroid, that could be, but you might have what we call a normal low free T3. And so what I learned while we were doing a lot of research with this, and that's why I love doing this, we're actually still learning and always learning still. But with this, iron deficiency anemic patients have a hard time converting the T3 from T4, and T3 is the active form. So what I've learned is how sometimes T4 goes straight to the reverse T3. So you might have a patient, or your labs as a listener might have normal CBC, a normal quote unquote thyroid, but then they have a high reverse T3. But if they're symptomatic, this is something we should definitely dive into and do a workup and check their ferritin levels.
Yeah. So, iron can also block the absorption of thyroid supplements. So you have to be careful with that. And also hyperthyroidism can cause a high ferritin level.
Right. And I call that the feeling wired but tired. So if they're, you have, unfortunately, you're at the spectrum on both ends there.
Yeah.
And, what about vitamin D? Is there any protection with vitamin D?
Yeah. Vitamin D supports red blood cell formation. Vitamin D is necessary to so many different functions, but this is another one that vitamin D plays a role in. That's why it's important to know your vitamin D level. Do you have adequate levels? And we also tell people, as far as medicines, there are certain medications that can affect iron absorption, certain biologics that were used for arthritis, IBD, psoriasis, etc., and inflammatory foods. There's certain inflammatory foods that can inhibit the absorption of iron.
So I have an anecdotal story, actually. So there was a patient who was cooking on her cast iron skillet. And this is something that I didn't realize you can get iron from cooking on the iron skillet. And so that actually can cause, you might see high iron levels. And if you don't have a cast iron skillet and you are iron deficient, go for it. I also learned molasses. Some people put a little molasses in their coffee, and that can actually help with iron levels. So I thought that was really interesting. And we always go back right to the fact of the gut, right? So avoid inflammatory foods and highly processed foods. We got to fix the gut, and that will allow you to hold on to the iron you have and allow you to absorb the iron you're putting in your body.
So what's our takeaway point from this podcast? I would say that if you have unexplained symptoms, any symptoms, including all the ones we talked about before, go see your doctor and make sure that they're doing a full, adequate workup. They're not just doing a CBC, but make sure they're doing a ferritin level. And then if you do have an abnormal ferritin level, make sure it's being addressed and treated. It's always nicer if you have a doctor who does IV iron infusions in their office, because I will tell you that is the best way to get iron stores back up, and you'll feel better. Most people feel significantly better after their iron infusions.
Stay tuned till next time.
The information contained in this podcast is provided for informational and educational purposes only and is not intended for the purposes of diagnosing, curing, treating, or preventing any disease. This podcast is provided on the understanding that it does not constitute medical or other professional advice or services. Before using any products or services referenced on this podcast, consult with your healthcare provider, carefully read all labels, and heed all directions and cautions that accompany the products. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Dr. Brian Marias, Deanna Weilbacher, and Hybrid Medical Solution, do not claim responsibility for any adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for any statements made by the guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referenced.
If you would like to submit any questions or if you have any topics you would be interested in hearing about on future episodes, please contact us through our website, www.hybridmedicalsolution.com. That is solution with no S at the end. Follow us on Instagram and Facebook, all under Hybrid Medical Solution.